Hi everyone, here we are again at Greener Pastures Veterinary Service, and I have with me today Dr. Jim Bertram. Jim is a chiropractor for animals, and we want to spend a little bit of time giving you an opportunity to learn more about this through our program, My Dog and Me. So I'm going to introduce Jim to you. He's going to tell us a little bit about his education, a little bit about the whole situation, and then we're going to show you some of his work on two particular animals that we're going to bring in to do that with today. So Jim, tell me about yourself and where you're from and what do you do?
Okay. Thanks for having me here.
It's okay.
I'm from Sagertown and been in chiropractic practice, human chiropractic practice, since 1987.
Okay.
So that's 26 years, I think, plus. And I, in 2007, became certified as a veterinary chiropractitioner, is the term. So that I'm certified to adjust animals. And I've been affiliated with Greener Pastures since that time. And I was in practice, human practice in Sagertown for about 25 years, and last year and a half in Meadville.
Well, now let me ask you a question. There's a lot of chiropractors in the phone book. If I have a bad adjustment that I need or whatever, I can look that up. But what makes you decide, or what makes a vet decide to go to animal chiropractic medicine, and why don't they all do that? I mean, I would think there's quite a need for it.
Yeah, that's a good question. It's a new, an up and coming in the treatment planning with veterinarians. As part of the veterinary curriculum in the past, when we talk about years ago, certainly decades ago, chiropractic wasn't something that was mentioned, nor was rehabilitation, things like that. Now you're seeing that as part of the veterinary curriculum. So now when you're looking at treatment planning for a specific condition, chiropractic makes the list. And so therefore now you're seeing chiropractors affiliate veterinarians affiliate with chiropractors more for some conditions. I think we have a long ways to go in developing where we as chiropractors fit and where the chiropractic adjustment fits in certain veterinary conditions. I think there's probably more of a role than where we have it right now, but it's just kind of evolving. As we know with anything like a college curriculum, it takes time to evolve, usually kind of a generational thing, because you have instructors of a certain generation and mindset and school of thought, and then as that changes, it's almost like a generational change, and then that comes around to the treatment planning. So it's almost like a 2 or 3 step process.
Sure, and I think all of us of the older age, such as I am, we remember going to the veterinarian. It was shots, it was spayed, it was neuter, and that was just about it. And anything else that came along, forget it. You had to maybe go to a specialty place, such as the place in Pittsburgh on Camp Horn Road.
Correct.
But now we're seeing a lot more done. And with our programming of My Dog and Me, we have seen the laser, we have seen the x-ray and the diagnostic tests that have been done here. We've seen so many things. They've branched out in so many directions. And that's why we wanted to make sure that we gave the people an opportunity to find out more about this. Now, whenever we're doing the adjustment with your dog first, we're going to be talking about what all happens and what type of dogs are candidates for you. Because I have always been under the impression that the majority of dogs that come to a chiropractor are the performance dogs. But we'll talk more about that once we've got, what's your dog's name?
Honey Bun.
Honey Bun.
Honey Bun.
I hope I remember that. Honey Bun will be in here, and we will go through that and give you some ideas, and then we'll talk as we're showing some things, so that gives people something to look at. So why don't you get Honey Bun, and we'll go from there.
Sounds great.
Okay, perfect. We're back, and we have with us Honey Bun, who is a 13-year-old golden. You've had her since she was a pup?
Yep, from the shelter.
Okay, look, from the shelter.
Yeah.
Oh wow.
Yeah, she's a mix.
You've had a good life. Yes.
She has.
And of course she has her steeler collar on. I don't know whether she wants to wear that right now.
Yeah, it could be embarrassing.
Could be embarrassing. Maybe we should have taken the steeler collar off. Anyway, so let's talk about Honey Bun and what you've done with her. If anything, while you're beginning to talk about that, I've had older dogs, and I've noticed that she's very mobile. She moves very, very well, obviously.
Right.
How often do you do stuff with her?
She gets adjusted about every 3 to 6 weeks, maybe 3 to 8 weeks.
Oh, that's all?
Yeah, we'd like to do once a month, but you know, life gets busy, and we always neglect our own. But she gets about every 3 to 6, 8 weeks. She gets adjusted. Or if we notice that there's an issue, her only problem, she's been very well dogged. She's a great dog. We notice that she has a little bit of weakness, a little arthritis in the back end.
Well, let's talk about how a dog gets to you. So a dog comes in, sees one of the veterinarians here.
Correct.
And the veterinarian determines that because of, give me 3 examples of situations that would involve you dealing with the dog.
Sure. Number one is said that they suspect a disc herniation in the spine. Disc is the structures between the vertebra in the spine, and it's a shock absorber as well as a strength giver to the spine, and oftentimes they will swell or pooch out, bulge, what we call herniations. If they suspect that, that's one of our prime treatment targets.
Okay, so the vet then contacts you.
That's right. I'm here every Tuesday morning. Then they would be put on my schedule. They would have whatever veterinary treatment that they're having, which medications, maybe some physical rehab, and then to me. And
that's given as an option then?
What's that?
You're given as an option that they can take?
Yes, and then the owner can decide.
So that's one way that you get a dog. How else would you get one? After surgery?
Potentially, we have done after orthopedic surgery. Say there was a cruciate tear in the rear leg, maybe because that dog had been limping or three-legged for quite some time, that during the rehabilitation process afterwards, that I would be called into, hey, let's fix any imbalance that there might be in the back end of the dog, and then that would help with the rehabbing and the getting back to normal after surgery.
Okay, now, and just to remind everybody, we did do a whole program out here at one point with Edie, who is a physical therapist, so you worked very closely with her, with the veterinarian, to do this. Now, one of the things, let's talk about what you've got there, and then we'll talk about something else.
Sure. The adjustment itself, let me first go back and talk about what are we trying to accomplish with the adjustment. There's 3 things in the animal world that we're trying to accomplish with the adjustment. The first thing is that we want to what we call free up what we call the fixated joint. That's the joint that might not be moving well. This part of the spine that might not be moving well. That's easy for everyone to understand. If this isn't moving well, then I want to try to make it move better. And that is the obvious one that we can all understand. There's 2 other things that happen with the chiropractic adjustment. One, the first one of those 2 is that when we're stimulating the spinal joint, it stimulates what's called mechanoreceptors. So here's our neurology 101 that we always talk about. Chiropractors always talk about. We stimulate mechanoreceptors, which send a signal to the brain to try to turn off pain and inflammation. So, and what's probably the coolest thing about this is that our stimulation to the joint and to the mechanoreceptor is faster than the pathway for pain and inflammation. So we're trying to almost speed by that and turn it off, or at least modulate it or slow it down, because we have this fast pathway. And then the final thing is when we adjust and stimulate along the spine, we stimulate the autonomic nervous system. And the autonomic nervous system is that part that as humans we know is we call it the... Can you sit down? Sit for me.
Should I sit?
Sit.
Sit down, hon.
Sit, sweetie.
No, I guess she's going to stand. Okay.
She's going to stand.
I got it.
What we as humans call the fight, flight, fright system, that like if you almost hit the deer and you feel all your heart rate increases, you feel all shaky. That part of the nervous system is also the part that, of course, it regulates our heart rate. It regulates our bowel, our bladder. And so we can actually have an effect potentially on those, if there's an issue with, for example, urinary issue because of arthritis in the spine.
So that's a benefit for any dog, those three things. Okay,
correct.
Gotcha.
Yeah, and so then how do we perform the adjustment? An adjustment is a force applied. So you can apply the force by hand or by mechanism, okay? And excuse me, if you apply a force, so if I have my hand and I'm extending back and I'm pushing down, I have a force, and then I have a mass that I'm applying, and then I have an acceleration. Force is mass time acceleration. So I have the mass of my hand, which is fairly heavy, and then I have the acceleration of my hand, the movement.
Now you do that on most dogs, that hand, or do you do
I
the...
don't. I use the instrument.
Okay, use
we'll
the
talk
instrument.
about that, but
Okay.
you can use your hand. Again, it's force equals mass times acceleration. So with my hand, I have a fair force, fair mass with relatively slow acceleration because
Okay.
my muscles can only move so fast. The instrument has a very small mass.
Can you turn that so they can see that better? There
very,
you go.
very small mass. It's just a little tip, but it has a very, very quick
Turn it
acceleration.
the other way so it's facing, there you go.
Like that.
There,
So,
perfect.
so it has very fast acceleration. So small mass, much more acceleration than I can have. So the force can actually be more.
Now, do you use the same type of an instrument used on a person?
Yes.
Okay.
Yeah, because it's the same thing.
All right, same idea. So this isn't just an instrument or a mechanism that's used on animals. You can use that on a person.
Can be used
gotcha.
as a human instrument as well. It all comes down to that formula: force equals mass times acceleration. Mine may be larger mass, but not as big of an acceleration. Smaller mass, much more acceleration.
How much pressure does that? Is there a way of calculating how powerful that is?
There is. I don't know.
I wonder how big it is. I mean, I wonder how
well,
powerful.
when you can, it's spring loaded, so you can get. So when we're say doing manipulation on a horse or a cow, a 1,500-pound cow, I can add more mass.
Okay.
Yeah, more mass to it, and I still have that acceleration. Whereas with the dog, especially when we get Lily in here, a much smaller dog, you'll see that I'm using. But see, I can get more mass, but I still have that quickness of the
Now, how long
acceleration.
does it? Well, you're going to start doing that now.
Yep.
How long does it take for the whole system to? I mean, how long does it take you to do this?
To do this, just a matter of minutes.
Okay.
Yeah, very quickly. So what we do with Honey Bun is, and what I do with most dogs, unless if I know there's only an issue with the back end, a lot of times we'll start here and go down.
Which is very common with older dogs.
Right, and if there's in her case, she's been adjusted many times, and I'm just trying to make sure she doesn't have any problems top to bottom. We go top to bottom.
Does this work? And I was saying the older dogs. Does this work for arthritis in dogs?
We see a lot of when I said about disc, and then we see as an adjunct to maybe other orthopedic problems. We see a lot that have especially spinal arthritis here, where the openings where the nerves come out, if they get narrowed, then oftentimes they'll have me see
So an
that
alternative
dog.
for a dog having difficulty with the hindquarters and things like that
Is to try chiropractic, because our arsenal, the veterinary arsenal is medications, and then we add some of these other things as compared to before, where it might just include medications.
Okay.
So we have this. What we notice with Honey Bun, again, like I said, is that she has a little bit of problems in the back end. When she gets that problem with the back end, we notice she starts using the front a little bit more, and she actually curves out a little bit, because that helps her get up and down. So that's why I also go top to bottom with her.
Okay.
So let me demonstrate.
Yes,
okay?
please.
So
While you're doing that, I can ask you another question?
Sure.
We talked before, unlike just you doing this in your office in Meadville,
right.
you have talked, I believe whenever you did a program on a seminar out at the dog park, you talked about the fact that you work very closely with the veterinarian,
Right.
and that you, explain that to me. I remember you were saying something about the importance of you with a vet, and the vet being in on all the treatment and kind of supervising what you do. Am I right on that, or
Correct.
was I getting that confused?
No, you're right, and that's, and I'm just about done with the first, what we call first pass with that. And I want to explain some of that, but let me answer that. That's probably one of the most important questions, and one of the things that we really want everyone to understand is that in the Commonwealth of Pennsylvania, the law is very, very clear that for a human chiropractor trained for animal chiropractic, there has to be some sort of veterinary referral or affiliation. I like to use affiliation, and we at Greener Pastures take that very seriously because they use the word supervision, and what that means is that there must be formal communication and oversight by the veterinarian of the chiropractor with each case.
Okay.
Now, there's lots of ways to interpret that. We interpret that very strict here, and we take that interpretation into action by how you were describing. The animal would see the veterinarian, and then the animal is put on my schedule based on what they think needs to be done, and does that include chiropractic or not? And I'm brought in to when they think that it should.
Well, I have 4 dogs, as people know, and I want the best care, and I therefore want to make sure that somebody's just not grabbing that mechanism in their hand and doing that to my dog, unless
or
there's a veterinarian. That I want the veterinarian there also, so I would want that.
And that's
I would want you to be talking to them the whole time about this.
And that's the second part. So the first part is there has to be the formal communication and the oversight, which we do by how we schedule it, how they see it. Also by when I come in on Tuesdays, I'm looking on the computer system and looking at all the notes, and then communicating with the veterinarians as to hey, what's going on here, and then also even potentially reviewing X-rays. We do all of that. And then the second part is that there's always at least one, usually 2 veterinarians here. I would not be doing this right now if I didn't know. We have 2 veterinarians there.
Right.
And when Lily comes in, the referring veterinarian is right there. I've already, when Lily usually comes in, how I do it, I've already reviewed everything.
Sure.
And oftentimes there's situations where the veterinarian's actually in here, when we need updates and things like that. And if I have any questions about are we on the right path, that's when we also then say, hey, it's time to schedule with the referring veterinarian here to have a follow-up.
Honey Bun wants you to continue.
Yep. So let me go down through. So what
So
we
you
do,
did one pass.
I did one pass. And what we do, I start at the very top, the very first vertebra. It has 2 big wings on it, which I will have right on my thumb. And there's that. And then the other side. She usually loves getting adjusted. She might be smiling. I don't know.
I don't know whether she's smiling or not, but she's looking pretty good to me. You're a star here, Honey Bun.
And
you're one of the only stars in the area. Not a lot of dogs have been stars.
That's right. And what we're looking for, and it's hard to see with all her fluff, but animals give us an indication of where they actually truly needed to be adjusted. And you might be able to feel like if you put your hand here, that you'll feel a little muscle contraction when we get to the right spot. And that's tells us that vertebra was fixated, and we're freeing that up. And then I go down and we get the sacroiliac joint, which a lot of humans have problems with, part of the pelvis right there. That's pass 2. We usually do 3. Sometimes I just do 2, depending on how, if the animal is very painful. Oh, you're tired.
Honey Bun, are you going to have one more pass?
We're going to have one more pass, and then we do a procedure that stimulates that part of the nervous system I call the autonomics, which is a little different. So we're going to do one more here, sweetie. We're going to do this. We come down, we're right on the spine because it doesn't hurt them at all. As you can see, she's not in any distress. And then we go down through. We usually, with her, we've had very little problems up top, but we start to get them right about here.
What do you think, huh? What do you
And
think?
down
I know
through.
you're a good girl. Yes, you're being such a nice girl. Yes.
And then back to the pelvis again. Yeah, she's getting you all worked up, honey bun. And then when we stimulate the autonomics, we just go off to the side. So I'm just going to go off to the side.
And that's just one pass of that?
Yep. I just kind of go back and forth.
All right, let's talk about the average dog comes to you just for a chiropractic. I think we'll wait till we do a performance dog because that's a little bit different.
Sure.
As far as how many times. But so she's now you're also doing her legs, or?
Yep, because remember I said she bows out a little bit. I found if I just kind of free up that joint right there, she does a little better.
Oh,
so,
good.
And then this one I just come around and I just find my spot, and she's done.
There you go. And you've been a star, and you've been one of the
great.
best.
She's
Yes.
great. She usually loves to get adjusted.
Anything else we need to know about Honey Bun and the basic adjustment here, or
No, I
can we
think
move on to the next type of dogs?
I think we can.
Okay, well, we're going to take a quick pause as we change dogs and let Honey Bun have a break. A few moments ago, you saw us do Honey Bun, which was Dr. Jim Bertram's dog, and now we've got Lily, who belongs to Katera Peters. If you recognize Katera Peters from My Dog and Me, she does an awful lot of our training at the Bark Park, and she did some of the programs that you will be watching on Armstrong on the rally and on the games class and 2 training classes. And also you've seen her with therapy dogs and things like that. This is Lily's second big appearance on Armstrong because Katera just reminded me that we used Lily one time when we were doing a program on therapy dogs because she's so popular as a therapy dog because of her size. So we were talking to Dr. Jim about the fact that we used when Honey Bun was in here, we were using a dog that has a medical condition that would require you to make an adjustment on that dog either because of see how good I am at this, either because of an injury or a surgery or something like that. And we also were talking about the fact of how we have you work with the veterinarian to make sure that we're providing the right type of a service.
Correct.
We're going to take 1 second before we start here, Katera, because I did forget to ask you, whenever someone such as yourself decides to become a chiropractor for animal control or animal care, you say there are 2 different ways a person can go. What are those 2 ways?
Yeah, there's the 2 ways. One is you can be certified through I always have to think I get the names right, International Association of Veterinary Chiropractitioners, and then there's the American Veterinary Chiropractic Association, and they both have a tract, of courses that they provide.
Okay.
I got a
Which one did you do?
International Association of Veterinary Chiropractitioners. In addition to that, there are some specialty seminars, for example, like an equine adjusting that you can take, but not for certification.
Do you do that?
Yes.
You do the horses and things like that?
Yeah.
Mostly horses?
Horses.
No time you do pigs and goats.
My goat.
You're his goat, okay, that's
And
interesting.
I've adjusted a couple cows.
Cows?
And, so mainly it's dogs, horses, occasionally a cat.
I was going to say a cat.
Then what I'd say, cows, goat.
Okay. Okay, we're going to jump now and talk to Katera. Katera, tell us about Lily and her great moments of fame here and what she comes in for, and just about Lily in general.
Well, Lily's a miniature pinscher, and she's 8 years old. She started out as a conformation dog, but she is in the competing in agility. And so when she was about 2 years old or so, she tore a cruciate. And for that rehab, we did swimming and some other things. But the chiropractic and the laser has really helped her because of her injury. She tends to compensate. And so she will get a pinched nerve in her back, or she throws her back out. She is also much of a hunter that I was just saying this weekend. She tore my decorative pond up again by hunting for critters.
Okay.
So a lot of times she'll throw her back out, and it's amazing just with calling Dr. Bertram here. We get her in here, and the treatment just makes a difference within 24 hours.
Cruciate, that's in the knee?
Yes.
Okay, the cruciate's in the knee then.
Yes.
Okay, and now in comparison to Honey Bun, who was here, now we've got the performance dog. How often does Lily perform?
She performs probably a couple times a month, which would be 2 or 3 days on a weekend. So probably 4 to 6 times a month on top of class every week. And so it keeps her coming here in top shape, because just like any athlete, we need to keep her fit so she can continue to do what she does.
And my big question is then, as the owner, because we were talking a little bit while we were waiting for Lily to come in, about the owner being very, very proactive and being aware of their dog. So whenever Lily's sending you the message saying, you know what, I'm not feeling so good.
Right.
Then you make the phone call.
Right.
And then you talk to Dr. Bertram and get Lily in here.
And she is now on a maintenance program, which actually for a lot of people it's very important. It's like us. A lot of times we wait too long, and then when we come in it takes us longer to recover. She is on a 4 to 5 week maintenance plan, and she comes in every 4 to 5 weeks to see Doc Bertram and to get a laser treatment, both, and that has kept her on track. She very rarely has a setback where we really need to do an additional visit. As long as we keep on top of it, it keeps her in shape. So unless she does something silly like doing a lot of digging and that sort of...
Or redecorating your pond.
Yes, redecorating my pond.
Good. Way to go there, Lily.
So anyway, and of course you could see she's a little high energy. She's ready to go here, so...
Okay, so let's talk about what you're going to do with Lily and
Sure.
how this either compares or same as Honey Bun or what.
Very, very similar as far as the adjustment. We do the passes like we did, and I'll show those without all the fluff that Honey Bun has. If we see an area that's fixated, we should be able to see the contraction a little bit better for the camera. And with the agility, the two things that we mainly see are a lot of times that there's muscle tightness issues because of pushing one way or the other, and the other thing is we see issues at the pelvis because of, again, the same sharp turns, just like we would do.
Especially from the agility with her.
Right. And you've also, not me, but you've relayed to me that what kind of surface Lily performs on does reflect on how the spine is, because when certain ways that she can dig in, she does a little bit better. So it's very interesting. That's a very mechanical. When you think of what I'm doing here, and that first thing that I talked about, the fixated joint, well, that's obvious. You can, if you're turning and there was a little slip or something with that turn, there's certainly a mechanical stress there that could go right up to there, or it could go right up and through here.
Well, let's try it and see how she responds to this.
And also, Lily had a little neck issue there way back, but not in most recent times. So we do go up to the neck and
one of the things that we did while we were waiting for Katera to bring Lily in is I was asking Dr. Bertram, is there any pain with that, or how much pressure is there felt on that? And of course he did it on my arm. Meantime, I can't move my arm now. No, I'm only kidding.
Nice.
But anyways, you can feel a little bit of pressure. Hardly anything at all, actually.
And if you notice by her response, again, she gets this done quite a bit, but she's not worried about it. She doesn't really flinch about it. You might see if he hits a tender spot.
Yeah, and we saw that right in there a little bit. And nothing dramatic, but there were just a little bit. What? You want that done again? Smell it? Slicks it. No problem with the neck this time.
Do you ever have a problem with a dog that doesn't like it?
I've been blessed. We don't see a lot of that.
You don't see one that just comes around on you whenever you're doing it or something like that. Probably the noise more than anything initially.
Did you see that? There was a fixated joint, because you could see right there, that little contraction. Hard to see on camera, but little contraction. You felt it on Honey Bun.
I felt it on Honey Bun whenever you did it.
Pelvis is actually pretty good. So just the muscles up and through here. So almost done.
Now, whenever Lily comes in, you see Dr. Bertram first. Now, you also said she's getting laser today.
Yes, with Edie.
With Edie. Now, those of you that have watched some of our other programs on My Dog and Me have seen us do the physical therapy work with Edie, where she does a laser, and then she has, if I recall, the treadmill and also the Cavaletti bars?
Correct.
Oh, I finally learned that.
You got that.
Okay, the Cavaletti bars. And so she'll have a session then with Edie. So you do both?
Yes.
Yeah. And sometimes we do them in reverse order, depending on how the day is going. I don't know if we really found that one,
No. But they do go hand in hand, I feel, with what I've seen through Lily. It's
done.
really...
Almost done.
The laser helps. Are you going to sit
Yeah, and we can show we can do this sitting too. And the other, and to me, to answer the other question about, I've been blessed with really good dogs. Any dog that has come back to try to nip at me, it's not when I've been adjusting. They usually like the adjustment. It's usually when I was poking and prodding too long. As a chiropractor, we're always poking, and if I poke too much, that might get the dog's attention. The adjustment they usually love.
Katara, how do you know when she needs an adjustment?
She actually tends to either chew on one foot, her toes.
The toes.
Okay. Or she will fling one of her back legs.
I've seen her do that occasionally.
And that's when I know that she's getting, and it's typically back through here, she's getting tight, and it pinches the nerve back here that runs down the leg. And it's interesting because she was really bad. I think it was the last time we were in. And when they adjusted her, I'm trying to think if she did it when you adjusted her, but she flung right after. She flung her leg right afterwards.
Was that the last one?
Yes.
And that was the last time?
When he hit the spot. Also, when Edie did the laser, when she hit a particular spot. And so you know that they're hitting what you need them to get just by her reaction. But again, she loves coming in here and seeing these guys.
Now, was she, a lot of the different treatments we do on dogs, for whatever reason, they're kind of wiped out or so afterwards. There's no response here at all. I mean, this doesn't have any physical effect on her afterwards.
No.
That's
an excellent question. Lily doesn't. Sometimes we will see where owners will tell us that, hey, that dog just was pretty subdued and quiet and didn't want to do a lot that day, and then was great the next day. That's not typical, but we see that. But it's not that they're sore or they showed pain behaviors, but they just were kind of wiped out. We don't know if it's from the event of coming in or from the adjustment. Honeybun's actually the opposite. When I adjust her at home, then she starts running and tearing through the house like she's lost a few years. She's like she's 8 instead of 13.
Well, now, how often does Lily come? You said whenever she first started, she came how many times in a row?
Actually, no, she comes every 4 to 5 weeks.
Every 4 to 5, and that's just for this adjustment.
Yeah,
right.
And that's just because what Lily told us to do. Lily told us that was about
the. Speak?
Yeah.
Because I wanted to stay ahead of it.
Yeah.
So we want to, being that she is a competitive dog, now in the summertime, she's not as bad because she's running on a softer surface that she can grip. Now that we're coming into the winter, she's going to run on a thick rubber matting, which is harder on her because she cannot grip it. So
that might be the 4 weeks instead of the 5 weeks or something
so
like that.
So we adjust to what she tells us body-wise, if she needs it 4 or 5 weeks. But if you stay ahead of it, it's so much better for the dogs, and especially for the competitive dogs. Even for the seniors, I'm sure you see that if you stay ahead of it.
We were talking about that.
Right.
Using it on a senior dog.
Yeah.
It is much easier on the dogs. They don't have to take a day to recover. You're staying ahead of the process.
Right. And that also leads to, when we talked earlier about treatment planning, which is difficult and easy all at the same time. Like I said, Lily kind of told us what the right interval would be, and I'm a big believer in that. But for example, if we have a disc herniation dog, the protocols are pretty well laid out for that. We like to do a series of 5 adjustments over like a 4 to 6 week period if it's a disc dog. If it's a muscle strain, say there was a muscle strain in the neck, that's usually 1 or 2 adjustments. We kind of make the plan up because, again, if you do an adjustment and the dog's fantastic, you don't do 5 adjustments on that dog.
How old is she?
She is 8, and if I could, I had just thought about this. I have a 13-year-old Chihuahua at home, Chi-Chi, which we've talked about. We had her coming in on, she has a deterioration of the spine, really bad. I mean, the vets here don't even know how she's walking. It's so bad in her neck and her spine. She would go through spasms where she couldn't even move. She, to this point, I'm trying to think how long it's been that we've done this series. We did chiropractic and we also did laser, and she is not having any effects of that now. So the treatments can also, it can stop the progression of things too, and she's doing wonderfully from having both.
So Lily's 8, and you started these treatments when she was.
She's probably been doing them a good 4 years, I'm guessing.
I think so. Yeah.
She tore a cruciate about 2 or so. We started with laser and then into the chiro because what happens is we know when we get an injury, your body never functions quite the same. So she does compensate on her rear end, and you can see actually, if they can see it, she will sometimes see how she doesn't put as much weight on that back right.
Back right. Yeah.
Yes, she's sliding on the table.
Yeah.
So that's what causes the injury in the
Get
back.
some tightness up in here to compensate.
Yeah, I can see that whenever she's standing here, she just,
And that's the cruciate she tore, so she tends to put more of her weight on the other side. But
now, whenever she's not performing anymore, you'll probably continue with some laser as far as maintenance with her then, too.
Yeah, because it really just keeps her able to do what she wants to do. And she's a very active dog, so it depends on your dog too. But if they're active and they like to do active things, you need to keep them as comfortable as possible.
Okay, anything else we need to add about Lily?
No.
Thanks, Katara.
You are welcome.
Just a great dog, aren't you?
Appreciate it. Again,
Aren't you?
Katara Peters, who happens to run, if you don't already know that, the Groovy Pooch training that she does in Conneaut Lake and also in the summer down at the Bark Park. So make sure that you contact her if you have any questions about her training classes. And then she'll give you a chance to meet Lily and answer any questions that they might have about the chiropractic things as far as you're concerned as a owner of the dog. Okay, thanks very much. Appreciate
Thank
it.
you.
Excellent.
Okay, and we'll continue talking for a few minutes and wrap this up. And Lily, thank you for coming. Although I think Honey Bun was quite a star too. But you were good. You're good. Just a few things that we wanted to talk about as far as Dr. Bertram's concerned. How does a dog get to see you? We need to know that because we're at Greener Pastures, and that's a little different. I personally deal at Conneaut Lake Vet.
Correct.
So if I have my collie or my problem child, my Lhasa that has an issue, how do I get my dog in to see you?
Okay, there's two ways. Obviously, if you're a client of Greener Pastures, you see one of the Greener Pastures docs, and they determine the necessity for chiropractic. If you go to your doc, if you are talking to them about a specific issue and you want to ask them about incorporating chiropractic, if they concur that yes, that would be something that would be part of the treatment plan, then they can send a referral, and we have a referral form, and they would describe what's going on, and if x-rays were taken, what the x-ray findings were. Sometimes we've had the x-rays electronically sent, and then that does meet the obligation that we have that formal communication and oversight by them. They're in control. We then send records. When I type in my note, and then we have a little chart of the spine that we show where we found any issues, then that's faxed back to them. So that they are in charge, they have that, they are the referring doc. And at the same time, when it's done here, there's always at least one, usually two veterinarians here at the time, so that there is supervision of me, as well as there's that formal oversight by your doc.
Well, I think we as owners, and again, as I said, people know that I have 4 dogs, and I am associated with Conneaut Lake Vet.
Right.
And I'm have a wonderful relationship with all the veterinarians, but we as owners have got to become proactive.
Correct.
Just because your vet does not provide certain services doesn't mean that you shouldn't be aware of them. And you should either check out ask questions of your vet, or even go online and just see what the other possibilities are. Because so many times a veterinarian tends to channel their treatment towards what they offer at their particular practice.
In their comfort zone.
Right,
too.
and that's fine. And we certainly appreciate all that they do for us in this area. But you as an owner have got to assume some proactive action here. Right, and you have got to be looking at some of these different things. So maybe you say to your vet after being there for a period of time, hey, how about a chiropractor service? How about a laser service?
Right.
How about this service? How about that service? And these are the things that we really want to encourage owners to do. So that even if your vet is not at Greener Pastures, you have the ability to say to your veterinarian on any given time, hey, can I do this? Can I get physical therapy? Is physical therapy an option? Is chiropractic an option? So keep those things in mind. You can learn a lot of that by looking at some of our programs on My Dog and Me, and hopefully through thanking you very much for helping us today.
You're welcome.
Dr. Bertram is available. Greener Pastures is available. All the veterinarians are available, but be proactive more than anything else. I hope to see you again during one of our additional programs, and until then, see you later. Thanks.
Thanks.